Looking for a residency program that truly invests in your growth? Here's why PTSMC's residency program could be your best decision yet. So when you're graduating from grad school and you're really looking for where's that best fit for me for my first job opportunity, mentorship, continuing education, those are the things as a new clinician that are going to help you grow and are the things that you want to look for. It really shows that they're invested in you, and they're also invested in clinical success and clinical excellence, which is really important. I'm Danielle Dunn, and I'm a physical therapist, and I am also our director of our clinical excellence program and director of our orthopedic residency program at PTSMC. Here at PTSMC, we spend a lot of our time and resources on our clinical excellence and our mentorship of our new grads and our new clinicians, and providing support for all of our clinicians to continue to learn new skills. It really sets the momentum forward for them to continue to grow at a pace much faster than clinicians that do not complete a residency program, and sets them up for success down the road. The ultimate goal that we want our clinicians to feel that they have succeeded at the end of the residency program is to be operating at the top of their license. We want them to feel like they can handle complex cases and do it in the best way possible. I think one of the biggest things that they can gain is confidence, to know that they have the skill set and the clinical reasoning skills in order to be able to be an expert level clinician. So when applying for a residency program, especially at PTSMC, the ideal candidate that we're looking for is someone who's really interested in growing themselves. I always say it's the person who's a self-starter and really wants to learn how to self-reflect and continue to grow to be the best versions of themselves. Those are the clinicians that we want in our residency program. It's actually seen in the research that clinicians that complete a residency program are really fast-tracked with the skill sets that they learn to be an expert level clinician faster than their peers that don't complete a residency program. PTSMC's residency program is unique in the fact that we're one of the few private practice orthopedic residency programs across the country and in Connecticut. And that's really unique because most are attached to a collegiate system. So that really allows us to be very specific to how we want to run the residency program and how we want it to be part of our PTSMC culture. So our residency program's length is 12 months in length. So right now we start in January and then we end in the following January, which is something that we've done intentionally to give especially our residents who may be new grads who join us time to join PTSMC, get acclimated for a few months in their new space, and then start the residency program. At its simplest is they have classroom work that they do every week. So that's known as our didactic coursework. Split up over the course of the year in trimesters. So they do an upper extremities semester, a lower extremities semester, and a spine semester. They're also completing modules that cover different areas that maybe we're not covering in the classroom. And they're also completing research projects. They're doing weekly mentorship hours as well. And then at the end of the year, they do a big community project. That's kind of a culmination of the residency program. So our residency program really prepares our students to take the OCS, their board exams. We have a 100% pass rate, which is awesome. They spend an entire year studying for this board exam, which is a lot of time. So the coursework, the research, the modules that we have them do is really geared towards prepping them to be successful in that OCS exam. They take exams in the residency program, which are set up so that it's a very similar type situation when they take the board exam. The questions are very similar. And then they also get to talk to all their fellow residents who've taken it before and get a lot of really good tips and tricks as well. Residents balance treating patients and also the load of the residency program. I really work hard with them with working on time management skills in order to make sure that they can meet the demands of the clinic and then also with the demands of the residency program. And we also do a lot of check-ins, whether it's weekly, monthly. They know they can always reach out to me if we need to talk about how can we help manage burnout, how can we help manage where they're maybe feeling a little bit more stressed. The other really big piece is making sure they hold on to the things that are really important to them. So if working out is really important to them, how do they build that into the schedule in order to make sure that they still keep those pieces? We actually do a service loan forgiveness program where the cost of our residency program is forgiven if you stay at PTSMC for 3 years after the residency program, which is also a really great option and also can be unique to our residency program compared to other options out there. Often in other places, once that residency year is done, there's a new class coming in. They need to make room for the new residency class, and so then you're moving on and looking for a new job at a new place, whereas you stay with PTSMC and just continue your growth and trajectory. Day one to graduation, really the biggest difference I see is confidence. That problem that you might have been really nervous to approach and ask a question about is probably not even a problem they're going to ask about at the end of the residency program. And they just are more robust, if that makes any sense. Like they're more a 360 clinician in all ways, and they just seem more adept at handling all the problems. They really have that confidence to know that they have the skill set and the clinical reasoning skills in order to be able to be an expert level clinician. So when our clinicians finish their residency program, it's really kind of individual and up to them of what they want to do next. Often we time it so they end their residency program with still a few months left before they sit for their orthopedic specialty exam. After that's finished, they will start our LMDP, our Leadership Management and Development program. People who complete a residency program are usually also on a faster trajectory for leadership positions. And those leadership positions at PTSMC can be very vast, whether it's partner or director or roles in our administrative office, such as clinical excellence, mentoring. Most of our residents go on to become clinical instructors and then also teach and instruct in our residency program. We also have a lot of our residents who are busy exploring other opportunities as well, whether it's adjunct teaching roles in local universities, and then also becoming more highly involved in the community. So if you're considering joining the residency program, I always say it's worth it. It's a lot of work, but it's worth it in the end because you gain a lot of skills as a clinician that just fast tracks you ahead of your peers and gives you a skill set that you maybe wouldn't have in order to help grow yourself faster as a clinician down the road. And I always say reach out, ask questions. We'd love to talk to you about it. And also the big thing that I connect people with is talking to our past residents who can really give them the ins and outs of if it's worth it or not and how to kind of look at it from their point of view as well. If you're interested in joining PTSMC's residency program, visit ptsmc.com to apply. Thanks for watching. Be sure to click and subscribe for more videos like this.